I really had no idea, but I basically went on a listening tour. That is one of the things that I want to impart to you today, is to ask questions. I started asking questions to anybody who would talk to me. A lot of people have some insecurity, I think, about asking questions. They think it makes them seem like they don't know anything, but in the big scheme of life, none of us actually knows anything. I mean, every single person in this room knows something that I don't know and that you don't know. There's something you can learn from everybody. So I had learned that maybe from being a lawyer, that asking questions is not a bad thing. And when I knew that I wanted to do something in healthcare, I went on this listening tour. I would sit down with anybody who would talk to me, whether it was someone who had been a patient in Bangladesh, doctors, investors, entrepreneurs in the region, all across the world. Because of the networks I had built up in my life, I did get a lot of access to people, and I learned a lot. I started asking, one, what was needed in healthcare in Bangladesh? And two, what was happening in healthcare in the world that made sense, that I could learn from? Because I don't have to reinvent the wheel, actually. I can learn from things that have been happening in other countries and try to adapt them and cater them for Bangladesh. The one thing I learned in the World Bank is you can't actually import development, but you can learn. There are a lot of lessons learned from experiences that have happened in other countries. I decided, based on all of my research, that there were two big problems that I wanted to fix. Number one, there's a huge trust gap in the system in Bangladesh. There are good doctors in Bangladesh. There actually are really good doctors here. But there's something happening in this system that's causing a trust gap. The number one reason patients are traveling abroad, is actually not necessarily because of the quality gap, which is there, but it's because they don't trust their doctors. The doctor's not smiling at them necessarily when they talk to them. The system is not there. The hospital is making them wait. There's an issue there. Two, I realized I wanted to offer quality diagnostic testing. There were a lot of mistakes happening in diagnostics. There's only one internationally accredited lab in the country. So people were finding themselves sending their blood work out to 3 or 4 different facilities to validate those results. Sometimes even sending their blood abroad to make sure that the original test was right. That seemed to be a problem to me. So those are the two problems that I decided I wanted to fix. And that's how Praava Health was born. We're launching a network of health centers offering quality, reliable healthcare, family doctors, and diagnostics. Our goal is to be the first point of entry into the healthcare system. So we want you and your family members to come to us first when anything goes wrong, and you will have a doctor that knows your history and all of your family's history, and that will actually spend time getting to know you. We'll also have, all of this will be integrated actually across a fully integrated hospital information system that will feature a patient portal, where you as a patient can go online and check your medical records. You can go on your phone, make an appointment, and communicate with your doctor. You'll hear more about that from my awesome IT team in a minute, but this is basically the concept that I decided to bring to Bangladesh. So the first thing I needed to do was develop a business plan to test to a nurse's salary. So I, again, went on a listening tour, doing research to try to get answers to these questions. This required an incredible attention to detail. I didn't feel comfortable meeting with investors until I could defend every single thing that I was representing to them. Now, my business plan and financial model are not necessarily, crystal balls. I say to investors that, look, it's based on XYZ indicators that I estimate that I'm going to be doing this many tests on day 127. I needed to be able to be credible before I talked to investors, and so I invested that time and energy in building that business plan. I have a more than 100-page business plan, actually, that I put together, and it's evolved over time with the input of these great people here. But I actually, based on that business plan and all of that work, I was able to convince people to give me money to build this company. And with their support, we are launching our first facility here in Dhaka in a few months' time, which we're very excited about. I have actually a couple of pictures. This is a picture of what the building is going to look like. And that's basically rendering of what the lobby is going to look like. That we have some architects from abroad who are helping us with. I just wanted to share those with you because we're really excited about that. I have to be honest with you and say that this is the most difficult thing I've ever done. And Had I known how difficult it was going to be, I might not have done it. But I also didn't know how rewarding it was going to be. It's also the best thing I've ever done. Nothing has challenged me in so many different directions and filled my heart as much as this. And that is what I want that feeling for each of you. We haven't made one penny yet, and we're going to learn a lot once we open as well. We're going to learn that we need to revise our plans and all our models and all of that. And I keep telling these guys that every day. But I know that we're up for it. And to see this dream become a reality and to see this team that we've been so lucky to put together has been, one of the best things that I've ever done. Oprah Winfrey actually said that you get what you ask for in life. And I'm not sure that I believe that, but I do believe that you don't get what you don't ask for in life. So I want you to ask for a lot from your lives and from yourselves. That's basically what I'm here to ask of you. I think that you have to realize that you're going to face challenges and that you're not going to know what those challenges are. Even I standing here today, I have no idea what tomorrow is going to hold. These guys know. I mean, every single day is an adventure. I got 3 emails last night that, I had no idea were coming, for example. But you just have to realize that you're going to be up for it. And sometimes the hardest thing to do is to get through each day. I got those emails last night at 1 in the morning, and I had to finish preparing for this and wake up in the morning, and we all have to keep going. We have to keep going, and that sometimes can be the hardest challenge. But you have to be up for that challenge, and you have to have faith that sometimes just getting up and keeping on going is the best thing that you can do. I want you to understand that as much as I want you to dream big, and as much as I believe that there's so much that you can accomplish, I believe that the future is here in Bangladesh, and I believe that it's in my team and it's here in this room. I mean, you guys are the ones who are actually going to bring this country to be one of the fastest growing economies in the world. That's amazing. But I want you to also know that you're going to have to believe in yourself more than anybody else. Most of the investors I met with didn't invest in my company. I had to be okay with that. You're going to have a thick skin. It's true of most any entrepreneur. Most of the people you meet with are not going to believe you, but you have to believe in yourself more than anybody else. If everybody already believed in my idea, they would have already done it. The other thing I want to say, though, is that if you believe in yourself, you also have to work hard and do your homework. You have to be prepared. I believe that the difference between people who dream big and people who actually do big is hard work. And that is something that there's no limit on. We all come to this world with a certain amount of talent. Mozart was doing he wrote, his first concert at the age of 4. I did not do that. I don't know, maybe somebody else here did. But everyone has their own limitations, and you have to understand that. But there's no limit on how much hard work any one of us can do. And we have to hold ourselves accountable. We have to meet our deadlines and be on time and live up to the commitments that we make. Don't promise things to people that you can't deliver on. Because that is something that is something that you can control. You can control not representing that you can do more than you can actually do. I believe that, Aristotle said that excellence is actually a habit, not a virtue. I believe that if you pursue excellence in everything you do, in every little thing you do, whether it's cleaning your room or writing a term paper or your job, I believe that is how you're going to figure out what you love, because you're giving yourself your best chance. So I hope that, I've been able to share a little bit of my story and that speaks to you in some way. I want to pass it on to my team and have them tell you also how they got to where they are. They're all at different stages of their careers and lives, and I met them at different stages on my journey. The first person that I met who's here actually is Sabrina Imam, my IT director. I have her lovely picture and bio here for you. Then Sanjeev Pubucheri is my Chief Operating Officer, who is actually moved to Bangladesh from India to help us to build this company. And then lastly, you'll hear from Anand, who's our IT analyst, who's also joined us almost a year ago now.
Okay, so I'm really happy to be here today. It's been a while that I have walked into a university campus like this, and it's always good to see all these beautiful faces. About myself, I have to be honest, my career path is not even half as impressive as Sylvana's.
Yes, it is.
So please just stay put and hope you don't fall asleep. So I was born in Dhaka, and then when I was 2 years old, I went to Nigeria with my family. I spent my childhood years there, and then I came back to Dhaka for a few years. All of my adult life I've spent in the United States. So both my undergrad and my master's are from the States. Once I graduated from undergrad in electrical engineering, I joined this Fortune 500 company. It's called IBM. I'm sure you've heard about it. So I spent years at IBM working as a software engineer, project manager, and a team lead. And honestly, I started to get a bit bored towards the end. So when me and my family decided to move back to Bangladesh a few years ago, I was actually looking forward to it. So we moved back a few years ago, and I was starting to think what I wanted to do. One thing I knew for sure was that I wanted to get involved in a project or in a company that directly impacts the lives of the Bangladeshi people in a positive way. So here I was in Bangladesh. I knew what I wanted to do, but I didn't know how to go about it. And luckily for me, that's about when I met Sylvana. And she talked about Praava, and I instantly fell in love with the idea. Just the fact that there's going to be a healthcare facility in Bangladesh where the doctors are going to smile at the patients just had me sold. So that's how I became part of Praava. So here at Praava, as an IT director, I'm really excited about all the technologies we're bringing in. So currently, the healthcare scenario in Bangladesh is, you probably know this, that we don't have a lot of technology here. Most of it is paper-based, so this means that you, as a patient, would have to carry your medical files if you have a doctor's visit. So this thing is kind of a huge drawback for people like me who constantly keep losing paperwork. So at Praava, we're going to have an integrated EMR. So EMR stands for Electronic Medical Record. So basically, all your patient data will be digitally stored in a central repository, and it can be accessed throughout different healthcare settings. What an integrated EMR means is that not only the medical aspects of your data, such as lab, radiology, pharmacy, medicine, will be linked together, but also the non-medical parts, such as your billing history, your patient complaint history, your feedback history. All of this data will be interconnected, and it will be available not only to the medical providers throughout Praava, but also to you. So this is the part of the technology that I'm really excited about. Praava is bringing in the first patient portal app in Bangladesh. So what this means is that you, as a patient, you have access to your lab reports. You can make appointments online. You have your scans ready to view. You'll even know, like, when was the last time you made a doctor's appointment, or what was the name of your doctor. All of this information will be available to you through this app in your mobile device. Also, through this device, through this app, you'll be able to make lab appointments, in-home lab services. So that means that someone from our lab will actually come to your house and take the blood and urine samples for you, from you. Also, through this app, you'll be able to chat with your doctors and to other patients and share your medical ideas and medical queries. We're also going to have telemedicine. So that means that you, as a registered patient, you'll be able to remotely consult with your doctor. And you're also going to be able to have to order your prescribed medicines online. So there are a few other things that we currently have in the pipeline in terms of technology, and I don't want to divulge too much prematurely. I really hope that all of you will be there at Praava this summer with your family. We also have a web page and a social media page, and before I end, I really hope that you like us on Facebook. Thank you.
Guys, thank you for this opportunity of talking in front of you. I can see the future here of Bangladesh. So, to give a small snapshot about myself, I'm Sanjeev Publicity, and I'm from Hyderabad. I'm from India, and basically my place is very famous for biryani, like how your place is biryani is famous. Your place is for Kachi biryani, and our place is for the Iranian biryani, is what we say. Managing various roles at back office, customer service, finance, audit, quality, roaming, and all this. Basically, I did all the phases in telecom where I used to manage end-to-end customer lifecycle management. So this has actually given a very good exposure to me, and also telecom industry is as such where you are given a constant trainings to keep up yourself and be at pace with the technology, be at pace with the quality, be at pace with the new developments, what happen in the economy. So these are the few things which has actually built me over a period of time. Initially when I graduated, I did my BCom, MCom, MBA and leadership courses. So those things definitely give you a background, but at the same time the experience and the on-job training is something which will give you more insight about yourself and what you want to do, what you want to achieve, that will give you a proper direction. That's what I felt during my tenure.